Welcome to Family Health, a holistic healthcare show that aims to educate you, uplift you, and inform you on all matters health. My name is Liz, and I'll be your host for today. Now, I always say one thing: God gave us amazing bodies, and they do work very well. But in our lives, over the journey of life, we get illnesses now and again. And on this show, we aim to educate you on some of those illnesses. Today, we'll be looking at hypertension, which simply means high blood pressure. High blood pressure is actually quite high in Kenya in terms of the prevalence. It ranges from 12.6% to 36.9% and is particularly high in urban areas. Now we want to know, what exactly is hypertension? How do we know that we may have it? How is it treated? And can it be prevented at all? These are some of the questions we are asking today, because this illness is actually a silent killer. Why don't we listen to one of our doctors as we embark on this journey of hypertension?
I'm Dr. Isabel Makuduo. I'm a family physician by profession. I'm currently working at PCA Kiku Hospital. I'm passionate about family medicine, non-communicable diseases, especially preventable diseases, because it's something we can actually do something about. And I enjoy family life.
An estimated 46% of adults with high blood pressure are unaware that they have the condition. So, what exactly is hypertension?
Hypertension basically generally just means that the blood within the blood vessels is flowing at a higher rate than normal. So, because of the high flow in the blood vessels, it tends to cause damage within anything that is perfused by the blood generally. So the heart finds itself in a position where it has to work harder because the blood is flowing at a very high rate. So you tend to have certain symptoms as a result of this high blood pressure that is flowing within the blood vessels. Prevalence in Kenya is stated to be about 25%. Some talk about 12 to 30%. Globally, it's stated at about 30%. But with the lifestyle that we're having right now in Kenya, we're seeing more and more younger people having hypertension. Initially, it was more prevalent in the elderly. As you age, because the blood vessels become harder, you tend to have more hypertension. But now we are seeing it more in the younger population.
My name is Dr. Fiona Kahonge. I'm a recently graduated physician interested in cardiology, passionate about medicine in general, as well as non-communicable diseases such as hypertension, diabetes, cardiovascular diseases in general, because that is where we are headed as a country, as the world globally. We're looking at where are we going to be in 2030. And we're seeing that the incidence of diseases like hypertension and diabetes are going to be on the rise, the largest burden being in sub-Saharan Africa. Globally, from WHO, from different institutions, the burden is actually going to rise because we're increasing in terms of obesity. Look at the food that we're eating, the jobs that we have, the physical stressors, even from pollution in the environment. So that is where we're headed.
So what exactly is stroke?
Stroke is an injury in the brain that arises from impaired blood supply to the brain. Blood is not traveling in the vessel as it should to get to each particular area. The brain cells start dying off. So all that injury is called a stroke. There are different types of strokes. So we can look at them as two in general. So is it a blockage in the vessel, which we call a clot, which is ischemic? Or is it that the vessel has ruptured and our blood is flowing around the tissue, but it's not accessing the tissues as it should through the vessels? That's a hemorrhagic stroke. But then we also have what people refer to as mini stroke. Someone can tell you, I got that weakness, but with the next day it had gone away. So that one is a transient occlusion. So maybe the clot was quite small, it blocked the vessel, but then the flow was not fully occluded and the clot dissolved away.
According to the World Health Organization, stroke is the leading cause of disability worldwide and is the second leading cause of death. One of the main clinical risk factors for stroke is high blood pressure.
High blood pressure is categorized either as what we call primary hypertension or secondary hypertension. Primary hypertension basically means that there is no real reason why you're having the hypertension. It's as a result of genetics or even environmental changes. Then there's also secondary hypertension, which can be caused by other things like kidney disease. Do you have issues with your hormones, or is it lifestyle changes? So that is usually the difference between primary and secondary hypertension. So in secondary hypertension, mostly that's where the lifestyle causes come in, because it's something that is coming as a result of maybe poor diet or lack of exercise or a sedentary lifestyle.
So why is hypertension on the rise amongst the younger generation?
We are finding the younger population tending to develop what we call the lifestyle diseases earlier because of lifestyle. So we're having more of sedentary lifestyle where people tend to sit, they don't do more of exercises. Also diet. Before, like in the Kenyan or the local setting, people would eat more of local foods, but now we find ourselves consuming more of what we call junk, a lot of fats in our diets, processed foods, so we find ourselves having more of hypertension. Then also because of the kind of jobs that we have, long time ago we'd go to the farms and dig, but now we sit most of the time, so we don't have time to exercise.
So now that we know what stroke is, what is the leading cause of stroke?
The leading cause of stroke is hypertension. Either someone known to have hypertension and they're not well controlled, or this could be someone who has never had a medical checkup, so they have hypertension but it is undiagnosed. Other causes include smoking, which is one of the leading causes that we're finding. Others include irregular heartbeats, like what we call atrial fibrillation. Your heart rate is just very irregular, either fast or slow. The other causes like diabetes, physical inactivity, obesity, infections like HIV. The other causes for women, connective tissue diseases like lupus can also give you stroke. Use of contraceptives can give you strokes. Sometimes even trauma can give you a stroke as well. So there are those factors that we cannot change. Those are the non-modifiable. The one is increasing age. You find the older you get, the higher the incidence that you have to get stroke. Another non-modifiable is gender. Although globally we're finding that now the incidence between men and women is now becoming almost at par, with about 53% of women and 47% of men getting strokes. Other non-modifiable would be maybe a family history you have of high cholesterol and it's not actually treated.
The challenge with hypertension is that it can be a very silent disease.
Sometimes you might be not feeling anything, but the blood pressure is actually high.
So you will not feel anything. You know, you're just okay until you take the blood pressure. That's when you'll know. Maybe it's 200 and you're still smiling until something happens.
So what symptoms do patients with undiagnosed high blood pressure tend to present with in hospital?
Some people will have headache, others will have nausea and vomiting, others will have nose bleeding that is continuous, others will have blood vision, others to some extent others can collapse, and if it's too high, others they can get the paralysis of one side. That is what we call stroke. There are so many symptoms and signs and symptoms, but those are just the few.
So after patients present with these symptoms, how is hypertension then diagnosed?
We don't diagnose hypertension with one reading. Usually we say you have to have several readings. You're supposed to rest for about 10 minutes and you should be comfortable, and you should not have taken any caffeinated drinks, anything that can cause the blood pressure to go up. And once your blood pressure is taken, if it's high, it's repeated. And once it's repeated, you're advised usually by your doctor to have it checked regularly. Sometimes we give about a week or two to monitor the blood pressure. If it's persistently high, that's when now you start talking about lifestyle change, start talking about medication. So hypertension, basically, they actually figures what we call the systolic and the diastolic blood pressure. So we actually categorize hypertension into three. So normally your blood pressure should be at around 120/80. But there are different categories that we call pre-hypertension, which actually tells you that now you're heading towards hypertension. So there we have ranges of about systolic. Systolic is the top figure that you see when your blood pressure is taken. Diastolic is the lower figure that you see. So in systolic, in the pre-hypertension, we get about 120 to 139. Then we get diastolics of 80 to 89. Then we have now what we call stage 1 hypertension. Now this is hypertension proper. So there you have figures of about 140 to 159 over 90 to 99. Then we have now stage 2 hypertension, where we have it now at above 160 over above 100. We actually encourage that once in a while people should have their blood pressure taken, because you might not have any symptoms. I've said it's very silent. So when you go to a local facility, when your blood pressure is taken, so we say if it's above 140 over 90, usually now you're having hypertension. So your blood pressure has to be measured for you to be diagnosed with hypertension.
At what stage can hypertension be reversed without use of medication?
Once we diagnose a patient with hypertension, there are certain levels where we actually have to start medication immediately. So usually it's above 159, usually we advocate for you to start the blood pressure. But sometimes when we're at the pre-hypertensive stage or the stage 1 hypertension, we can actually put the patient on what we call the lifestyle changes, which I've actually alluded to earlier, which is the exercise, the diet, reduction of cholesterol. They talk about increasing your potassium and calcium in your diet. So we advise the patient to do this at least for about 3 months. So if this fails, we usually put patient on medication.
With regards to the different categories of stroke, how far-reaching are the effects in terms of mortality?
The most dangerous in terms of mortality is the bleed, followed by now the ischemic. The mini stroke, it doesn't mean that it's going to go away and you're going to be okay, because it gives you a risk factor. So we find that a lot of people in that 1 year, especially people who don't seek health attention and they're not put on treatment, or they don't undergo counseling in order to modify some risk factors, within the year they end up actually getting a full-on stroke.
Now, what is shocking to me is the number of young people that actually have hypertension these days. The number of young people that are just showing up to hospital with symptoms and then coming out with a diagnosis of hypertension. But what is encouraging is the fact that pre-hypertension, which is when the levels are not too high, can actually be managed by diet, by exercise, and I think that's a better path to take. But regardless, what I've also learned is if you do go on to develop hypertension, it is a very, very manageable condition. As we continue on this episode, why don't we learn more about hypertension? Why don't we learn how do we prevent it at the very least? Because if you can prevent this illness, I think that's better than actually going on to develop it. If you're at home and perhaps you have hypertension, what are your comments? I would really, really love to hear from you. Please let us know via SMS on 20316 or WhatsApp on 0786 316 316. See you after the short break. Welcome back to Family Health. If you're just joining us today, we are talking about hypertension, which basically means high blood pressure. Now, before the break, we looked at the causes of hypertension, some of the symptoms that people present with. Now, what we want to go into is the prevention, and we also want to see a live diagnosis of hypertension. How do people actually get diagnosed when they get to the hospital? It's very, very important, as we've heard from the doctors, to get your blood pressure checked now and again, because this disease doesn't always show, and it is known to be a silent killer.
Hi, how are you doing?
Thank you. How are you?
I'm good.
I've been sent by the doctor to come get my pressure done.
He has already informed me, so we can proceed and take your blood pressure. So I'll put the cuff on you.
The cuff is placed on the patient's bare upper arm, 1 inch above the bend of the elbow. It is placed tight enough so that one can only slip 2 fingers under the top edge of the cuff. The nurse starts to monitor and waits for a reading.
So, what we consider to be normal blood pressure is around 120 over 80. Anything that is above 140, 90, that one is considered as a high blood pressure. So your current blood pressure is 124/83, of which that is within the normal range.
A second measurement is taken to rule out any error in the reading, which can sometimes be caused by the patient being apprehensive about the result. How does stress contribute to hypertension?
We have actually seen several patients who, because of maybe work stress, family stress, they actually find themselves at a point where they have high blood pressure. And actually, when you're able to have a discussion with them, engage a psychologist, and they are taught of how to mitigate the stressors, how to cope with the stressors, we actually find that most of the time, sometimes the pressure goes down. When we actually involve things like counseling, sometimes the pressure actually can't stabilize.
With stroke, time is of the essence.
One key point of early treatment is that you're able to halt further complications from occurring. You get a handle on the illness early on, and you're able to start at a point where you can put down where you are baseline in terms of neurological function. So how much power does someone have? You're able to institute supportive and corrective measures like physiotherapy, like occupational therapy, so that someone can try and relearn some of the processes that they've lost through the stroke. So you have better outcome when you start early and you treat early, rather than someone staying at home with a stroke, not treated, because they could get further strokes that could be catastrophic.
In the case of a medical emergency, how can one identify a person who is experiencing a stroke?
Symptoms, common mnemonic could be something like FAST, F-A-S-T. So you look at the face for F. Are you noticing that there's one side of the face that is drooping? So you could look at their eyes. Are they able to close their eyes? Or is there one that is closing and the other is remaining open? You look at the angles of the mouth. Are they able to smile? Or are they smiling and the mouth is going to one side? So there's one side that is weak. The other is A, which stands for arms or legs. And so you could ask someone, or you could just notice they could be holding something and then they drop it. And this is not someone who's clumsy. And they tell you it's because my arm just feels very weak, suddenly lost power. Or they were walking and then they fell because the leg suddenly just became numb, became weak, and they couldn't walk anymore. Then S is a speech. So when you're talking to someone having a conversation and then their speech becomes nasal, or they're unable to talk completely, or there are those whose speech is actually good, but they're not coherent. So you ask someone a question and the answer is completely inappropriate. Either the words are jumbled up, or the response that you've gotten is not the expected response as per the question. And then T now is time. So you note what is the time that this has started, and then that gives you an inkling about how fast you need to get to a hospital. So you look at where are you able to access public transport? Do you need an ambulance? Do you have private means? Can you drive them to a nearby facility? And then immediately relay that information to the person who's attending to them, because this person may be unable to talk. So you, as either a family member, a co-worker, or a bystander, you're able to relay the information about the time when this has started and the changes that you've noticed up to the time that they've actually gotten to the facility. The key thing is get to a hospital as soon as possible. So if this is someone who's unconscious and is on the ground, you don't have an ambulance but you have means to transport them, you want to put them in what you call a recovery position. So they lie on their left side, so that on the side completely, if they're going to vomit for any reason, whatever comes out will just come out and not go back in. So first aid is a bit limited, but sometimes it can be life-saving.
How does stroke affect the lives of those affected?
The person is going through a lot. This is life-changing, because when you woke up in the morning, for example, you're okay on one day. On the next day, everything has changed. You're not who you were. So you need to understand that they go through a lot of psychological torment because of the incapacity that they are now having. So one is that they need a lot of counseling, a lot of support to understand that this is a new adjustment that they have, and they also have to work with what they are able to do. So if they are able to utilize one side, then they need to utilize that as they try and regain function on the other. The other is about matching expectations. Are they able to go back to their job or not? Are they able to go back to the role in the family or not? Family therapy is also very key, not just to the immediate family, but any player in the family who has been benefiting from that person also needs to undergo a bit of therapy.
A complication can arise as a result of the already pre-existing disease. What are some of the complications of hypertension?
Hypertension is we call it a multi-system disease where it causes bleeds within the eye, so you get what they call hemorrhage in the eye, so it can affect your vision. It can also give you strokes where you can get a bleed within the brain, or you can actually get clots. Then it can also affect the heart, where you get a heart attack, where people talk about you get a crushing chest pain, your pressures are usually very high. So most of the time you have to have immediate interventions done. High blood pressure also affects your kidneys, so that's why you find patients end up having things like dialysis. For prevention, what is key from what we are seeing, because currently, like even in our setting, the things that we are seeing that are really causing high blood pressure is kidney disease, and also, as I said, we're getting a lot of alcoholics with high blood pressure. We're getting a lot of obese patients with high blood pressure. We're also getting young patients with high blood pressure, but we look at their cholesterol levels are very high. So what is key is lifestyle. Lifestyle is key. Our jobs are quite sedentary, so we have to be intentional. We have to exercise right. We have to eat right. We need to reduce salt in our diet. So if your family, in your family there's a history of high blood pressure or diabetes, because most of the time they go together, it's important for you to be proactive. You have to be intentional, have regular checkups, have blood pressure taken. You have to be very intentional with your lifestyle, with your exercise, because you're at a higher risk of having hypertension as opposed to other people who do not have a family history.
Given the sometimes devastating effects of stroke, how can one prevent it?
Number one is to arm yourself with knowledge on what it is so that you're able to look out for it. The other is to understand what are the risk factors, as we've mentioned, like hypertension and diabetes. So this means that every year, go get yourself checked out. It doesn't mean that you're unwell. It means we want to catch these things early. So have a pressure reading so that you know what is your baseline pressure. It tells us when did pressure start rising. Look at your sugar levels, how are they? Another thing is to understand your family history. So in my family, do we have a history of hypertension? So I have to be very vigilant at the time that I'm looking for it. In my family, do we have a history of cholesterol abnormalities? That for us, our cholesterol is usually high. So that means I need to be on treatment. I need to be cognizant of what I am eating. The next thing is about diet. What are we putting into our bodies? Are we having a lot of sugar? Are we having a lot of fat, especially saturated fats? Are we avoiding good food like vegetables and fruits that have fiber, they are rich in antioxidants that are very good for the body? How much activity are we doing every day? So when we say activity, we don't mean your actual daily work. We mean at the end of the day from your sales job, you get home and you take a skipping rope and you skip for about 20 to 30 minutes. So we need that activity that is actually making your heart race, you're sweating, you're actually doing physical activity. The other is about alcohol and cigarettes. So we need to stop smoking. Even secondhand smoke, where you're seated or you're living next to someone who's smoking, also affects you. You need to reduce on the amount of alcohol you take. If you can stop altogether, the better. Other things for us women could be avoiding hormonal contraceptives if at all you can. It's also important for people who have hypertension and diabetes to make sure that their diseases are actually well controlled.
With their busy and sometimes unpredictable schedules, it is essential for doctors to find ways to unwind and recharge. What are some of the things that Dr. Isabel does?
Wow. My favorite way to spend the weekend is with my family and shopping. Yes. For me, the person who has really mentored me, especially in my medical field, is my mentor in family medicine. He's Dr. Joseph Thigiti. He has actually taught me how to care for patients, not only as a disease, but looking at people as a whole. Oh, comfort food, cake. For me, it's not even food, it's cake. Cake and chocolate. The man called Otto. Yes, why I loved it. Otto was a stingy man, but his neighbors taught him love. And at the end of it all, he saw in life what matters is how much you give back, the people around you, not even the way. He gave out everything. Dancing alone in my room, all by myself, so people don't see my 2 left feet. Yes.
And there we have it. Hypertension, also known as high blood pressure. I do hope that you at home are more educated about hypertension, what to look out for, and the importance of getting your blood pressure monitored regularly, especially if you already have the illness that is high blood pressure. For me, I think my take home was you shouldn't just always assume you're well, regardless of how you may feel. It is important, once in a while, drop into the pharmacy or their hospital and just tell them, I want to know what my blood pressure is. Just to make sure that you're not going beyond that level that we were told we are not supposed to go past, because then you start getting into the danger zone. Well, I hope you enjoyed that episode for today. For me, it was a great eye-opener. And like I always say, you may be ill. Some people are actually critically ill to the point of death. And at the very last minute, God comes in, stretches his hand and heals them. Yet others mysteriously die of conditions that would be deemed not even so serious, which teaches us that ultimately life is in the hands of our Creator. I do look forward to seeing you right here at Family Health on our next episode. Have a lovely one.